Hi guys, Dr. Steffan here with Evolve Chiropractic in Crystal Lake. Today we are going to be going over the foundations of proper breathing. So we call that diaphragmatic breathing. And what that really means is us actually using our primary breathing muscle, our diaphragm, to breathe properly, help take pressure off of that low back, and actually have proper mechanics with our core muscles as well. Okay, so the first thing that we're going to do, we're going to start by laying on our back. I'm going to use these two props to help kind of simulate how we're going to do this. So we're just going to get on our backs here. We're going to keep the knees nice and bent. This is going to allow our pelvis to kind of round out into a neutral position so that we're not getting any hyperextension in our low back, where we actually feel those muscles coming off of the ground. Okay, so we're going to start again with this kind of larger ball here on the stomach. Okay, and then one right here on the chest. So when you're doing this at home, you're just going to be having one hand on the belly and one hand on the chest. And what I want you to do is just keep those hands nice and soft so that you can actually feel the motion of what we're trying to accomplish here. Okay, so what we want to start by doing is taking a nice slow breath in through the nose. And exhaling through the mouth. So what you guys notice is that the yellow ball ascends or moves up, and the tennis ball here that I have on my chest stays right where it's at. Okay, so this is part of proper breathing mechanics where we don't see any chest movement until late breath. Now, a common mistake that most of you guys will be making at home is when you go to do this, what you're going to see is this tennis ball is going to want to start moving right up towards your chin right away. Okay, and this is again a faulty breathing pattern that's going to only contribute more to your low back pain, but it's also going to contribute to things like anxiety as well. Okay, so what we want to do, again, we're going to take a nice slow breath in through the nose, exhale through the mouth. We almost want to feel like we're pushing our rib cage into the ground. Again, this is going to help keep our rib cage nice and stacked over our pelvis so that our diaphragm can push down as we breathe in and tent back up as we exhale. Okay, so what I want you guys to do is to try this. I want you to do about 20 breaths, okay, and I want you to do this twice per day, okay? So again, in through the nose, having this ball travel up in the air, out through the mouth, almost like you're blowing out through a straw and watching that ball in the stomach descend, okay? If we're feeling like this is too easy, okay, the next step of this is we're actually gonna take both of our hands and we're gonna put them kind of in the soft spot on the side of our abdomen. So we're kind of looking for the bottom of the rib cage and the top of the pelvis, and we're gonna sink our hands right into the sides of our stomachs here. Okay, and now the purpose of this with our inhale is we're really trying to expand or push our hands sideways outside from our body. Okay, so again, we're gonna inhale through the mouth. Sorry, inhale through the nose, exhale through the mouth. Okay, and we're again making sure that this chest is not elevating as we're doing this process. Okay, so the same thing here, we're gonna do 20 breaths. 2 rounds of this. Now, the last step of this is we're actually gonna be feeling to get pressure into our low back, okay? And again, this is gonna feel like we're gonna be decompressing our low back, actually getting pressure down into our low back, which is gonna help kind of offset all the stress from our low back muscles so that we can stabilize our core properly, especially when we're having acute bouts of low back pain. Okay, so for this part of the exercise, we're just gonna take our thumb pads and we're gonna place those directly underneath ourselves. And again, we're kind of feeling like our pelvis is rounding out, so pushing that low back towards the ground. And as we inhale through the nose, out through the mouth, we really want to feel like we're pushing that low back into the ground. Okay, so again, this is going to be the most challenging part of the exercise. So again, starting with hand on the chest, hand on the belly, we're going to graduate to hands on the sides, and then we're going to further graduate to thumbs into the low back, trying to get that pressure back into the low back. Okay, so if we can successfully complete all 3 phases of this movement, okay, that's going to tell us that we're ready to graduate into further core exercises, because we're actually able to properly expand and contract the diaphragm, as well as all the supporting core muscles, those deep core muscles that a lot of the times we're not using properly when we have acute bouts of low back pain. Okay, so if you guys have any questions about any of the movements that I just took you through, feel free to reach out to the office and we'd be happy to help.